Hello. Yeah, thank you everyone for a really interesting discussion so far. I think we've covered quite a lot of really important insight on what the challenges are and also some examples of what's worked well. But I think we've had more examples of what's worked well at a national level, despite all the critique and challenges, than we have at the local level. And in light of lessons learned and what we can take away in terms of better preparedness for future potential pandemics or crises of this nature, what has been happening that's good in your local NHS that we may be able to scale up and sustain post-crisis? Thank you.
So maybe I could start with that. So so in Liverpool, we at a very early stage pivoted our local healthcare partnerships. So that's all the NHS trusts on our patch, and there are a lot in Liverpool. We've quite a fragmented NHS offer with what was 2 acute adult trusts and is now happily 1, but 6 specialist trusts, so a huge number of trusts who belong to our healthcare partnership. We pivoted all of those trusts and the 2 main HEIs who are active in infectious diseases research, that's ourselves and the Liverpool Tropical School of Medicine, into a new sort of goal command type structure, which we call Liverpool Stop COVID, which I actually chair. And we created this incredibly flexible, responsive system with a gold, silver and bronze command with operational pieces on the ground, and gold command overseeing the governance. And we did that mainly mainly because we had to. We in Liverpool lack significant NIHR infrastructure. We don't have a biomedical research centre or an academic health science centre. So we, in the space of a week, tried to recreate that infrastructure and the governance and framework that would have given us. What it actually allowed us to do, and what we are very keen to retain if peacetime comes again, is actually, unlike what happened in London and Hugh's experiences, we were actually able to retain our research capacity within the NHS. So the majority, not all, but the majority of our NHS partners have actually managed to not pull back research nurses to frontline care, because we had some warning and because we flagged that the fourth pillar of how we were going to get out of this mess was through high quality research. And working with our chief execs, because they were well sighted on what was coming down the track and what the need was, they've managed to retain that research capacity. It's also given us an amazing agility to do things that actually are well outside of my remit. So I'm a clinical academic. My job is to make sure that we do, fantastic education and research. I never for 1 minute imagined that I would turn into a small engineering manufacturing plant making PPE. But within the first week, when we got our Department of Engineering actually saw some code to 3D print elements of PPE, including full face visors, we went into wholesale production of PPE for our NHS partners. So we learned that we could do things as an ecosystem that we would never have imagined even attempting, during the pre-COVID era. So that creativity, that flexibility, that cohesiveness, the structure that we've created out of necessity that we didn't have before this, that's something that I am desperate to retain in the new normal, whatever that may look like, because it's given us a newfound cohesiveness and a closeness and an ability of a fragmented health ecosystem to respond as one. And it's also, out of adversity comes great things. It's made us creative, it's made us flexible, it's made us imaginative. And it's made us passionate about what we're doing on our patch. As I said before, we're all in it together, but we really do feel that in Liverpool, we're all in it together as a city.
Louise, I'll pick up on that as well. So I'd echo everything you said. We had exactly the same experience. We needed to design new CPAP circuits. We went to our engineers and we designed new systems within a few days, working with the university partners. We would manage the same with testing if we've not got stopped. Ethics was tremendous. You're much younger than I am, but we've probably both been through cycles of being told that ethics is going to be streamlined, made more efficient, made England a powerhouse for helping industry work with us. And every single level of this just paralyzes us further. And we are now slower and more up to our necks in ethics than we've ever been before. And that disappeared with this. Things were still completely ethical. They were reviewed by ethics boards and decided to be so. But if it can happen in 30 minutes in the middle of a crisis, Surely it shouldn't take 8 months the rest of the time. And we're reverting right back to that now. We are back to the same sorts of processes. Again, localism, not being trusted to produce stuff. The national guidelines I alluded to earlier on, we were trusted as a group of experts within the profession to produce national guidelines. We did, and they were cleared within 3 days. Now they're having to be going through a process of central review by people who know less about it than we do. And that 3 weeks later, we can't get them out. So let's get rid of some of this nonsense of road blocking and checking and process that really isn't necessary. The other things I totally agree with flexing. We were able to move people between jobs without worry about governance. And orthopods were able to turn into proning teams. Dental receptionists were able to turn into intensive care nurses. And they could, and they did. And if we allow people to step up to the plate, they perform exceptionally well. When we stop people stepping up to the plate, we deprive them of the opportunity to grow, and we deprive ourselves of a really rich resource that can support us all the way through. And furthermore, we've learned that by trapping our juniors in red tape and training and limiting their hours, actually, most juniors would like to work longer, not shorter hours, by preventing them working in teams as we do, and by making them fill in endless paperwork, they're demoralized. And it's why a third of junior doctors leave after only a year of having been trained. That's reversed. The level of enthusiasm we've had amongst our junior staff has been extraordinary. The morale has been fantastic. And I can tell you now, there are some trusts in London where the juniors are refusing to go back to the training and the rotas they had before, because they've now got a taste of what can be done when they're liberated from box ticking and can engage in a team to deliver excellent clinical care. So we've learned that too, and I really would like to see that retained as well.
Look, that is right, absolutely where I'm in this, the learning from this whole thing. So the need to pay proper attention to the soft stuff in the cross-organizational networks, the kind of networks that have really stepped up here, the critical care networks across regions, the ex-nurse networks out there, and that have come back, and the ex-medic networks that have come back to work. All those sort of social networks have been absolutely invaluable in this, and the priceless sort of soft stuff that has been mobilized here is forgotten about and actually dampened down by central control. And that balance, it's a duality, okay, but that balance has been wrong. And it's been wrong to the extent that it's created huge inefficiencies in the narrative of taxpayer value for money. It has created such inefficiencies as are legendary in the NHS about the inability to do things. What Hugh's just described, taking 10 weeks instead of sort of overnight approval, and the difference that makes to efficiencies. A trust setting up a manufacturing plant for something it needs in a matter of weeks. Those are the sorts of things. That's the innovation that is in the public sector that is latent. It's not even latent. It's suppressed. Now we need to retain that. We need to find a way to correct that balance. And I'm going to be I'm going to get in trouble for this one, but it's people who don't know what you're doing telling you what to do that's the problem. The lack of trust in the system and the lack of expertise. Let's call it the Fauci effect. What Tony Fauci is trying to do here is get expertise to the political table, and it's not being listened to, and that's missing. There's a bit too big a gap between the policy and the politicians and the practitioners. We've seen that become that has been breached, that gap, by local activity across the diagnostic and therapeutic and the practical stuff like supply chains. It's been phenomenal, but the centre has been 3 weeks behind the experts.
Can I just chip in there again with one more example? That was excellent, and you reminded me of something else in this issue of professionalism. Professionals, by definition, are prepared to act outside their remit and take responsibility. As far as I'm concerned, I'm happy to take responsibility, and if I get it wrong, I'll pay the price for doing it. And I'm very glad to do that. We were running the issue with low oxygen pressures. I contacted colleagues in the oil industry. They're able to supply 18 divers at 21 atmospheres with over 200 litres of gas a minute So supplying the oxygen levels we required in hospital was peanuts for them. But that was refused because apparently the oxygen that you breathe at 21 atmospheres in the North Sea isn't medical grade oxygen. It doesn't seem to be poisonous, and you can breathe it at 21 times atmospheric pressure, but that wasn't fit for being breathed by a patient. And furthermore, we were told that they couldn't do it because there was an explosion risk. And I tried to point out that they were dealing with oxygen at 21 atmospheres next to flammable oil and gas. The people who are most experienced in the world in stopping that sort of accident happening would be oil engineers. And we could have deployed them. The oil industry would have deployed within days, but they were prevented from doing so. Fortunately, we got away without needing it. But it's another example where we should free people up to take responsibility for their actions, I think. I'm happy to take liability for my own actions. I'm sure others would be too. And I'd like to see a liberation of such responsibility.